Welcome everyone to Deny Delay Depose, Health Over Wealth. We're tackling some tough issues today, things that impact all of us really. It's about generational trauma, healthcare worker mental health, and how that all ties into the bigger picture, the state of our society really.
Yeah, absolutely. It feels like we're on the cusp of something major, a real shift in how we view and deliver healthcare. And the pressure cooker that's been building in the system, well, it's starting to show cracks everywhere. And the Mangiane case is just the beginning, or maybe the straw that broke the camel's back.
I agree it's complex, but I'm not sure I'd go as far as to say the entire system is broken. I think we have a lot of great things happening, especially with technological advancements in research. Sure, there are areas that desperately need improvement, but I don't think we should throw the baby out with the bathwater, especially as more people are enjoying the benefits of longer lifespans than ever before.
Longer lifespan, sure, but at what cost? Are people thriving during those extra years, or are they just existing burdened by medical debt, chronic illness, and a system that seems to prioritize profit over their well-being? I saw this article about the USDA collecting sensitive data on food assistance recipients. So that just screams prioritizing profit and control over actually helping people eat.
Well, I understand the need to combat fraud and misuse of funds, right? It's a balance. The data collection, if it's done properly, could help streamline the process and ensure resources are going where they are needed most. It's a matter of efficiency, isn't it? And, making sure the system is sustainable in the long run.
Efficiency at the cost of privacy and potentially creating a chilling effect. I don't know, Sarah. It feels like we're sacrificing compassion on the altar of efficiency. This is exactly what I think Mangione was rallying against. Plus, how much are we really saving versus how much are we spending on things like the recently displayed military parade? How does that $25, $40 million parade jive with these apparent budgetary constraints?
Well, the military parade, it's a display of strength, a symbol of national pride, right? It's important for morale and projecting power. And, the military is a huge part of our economy. So
Morale? For whom? The shareholders of Lockheed Martin? Seriously, that money could have funded mental health services for veterans or, helped address the opioid crisis or a million other things that actually benefit people. The core problem is the incentives. It's about how we are optimizing for profit instead of people. In my experience, people react to incentives. Therefore, let's design a system that incentivizes health.
Exactly. And the healthcare workers are caught in the middle. They're dealing with the fallout of all these systemic failures, the burnout, the moral injury of having to deny care or provide inadequate treatment because of insurance restrictions, the trauma of dealing with increasingly frustrated and sometimes violent patients. It's a powder keg.
I agree that healthcare workers are under immense pressure, no doubt, but every profession has its challenges. We can't just attribute everything to generational trauma or systemic failures. People need to develop resilience, coping mechanisms, take personal responsibility for their well-being.
Resilience within a system that's designed to grind them down. That's like telling someone to swim harder in a rip current. We need to change the current. We need to optimize the system to promote wellness. Healthcare isn't just a job, it's a calling, and we're burning out the very people who are trying to answer that call.
And it's not just individual resilience. The recent news about Trump nominating Jeanine Pirro as the top federal prosecutor in D.C., it's about the people in power and whether they are actually qualified, or whether this is about getting someone loyal to do a specific bidding. I think that the erosion of standards in positions of power goes hand in hand with the healthcare crisis. It all comes down to a system that values things like loyalty over expertise or profits over human lives.
Hold on, I don't know if I see that connection. Pirro is a lawyer, she's been a judge, she has qualifications. And having someone loyal in a position of power isn't necessarily a bad thing. You want people who support your agenda, right?
But what if that agenda is detrimental to the well-being of the people? What if it prioritizes lining the pockets of corporations over ensuring access to affordable health care? We have to look at the bigger picture. It's all connected. Incentives, power, and people. As long as you have misalignment in those three things, you are doomed to have a broken system.
I think it is. It's like, the Labubu toy craze? It's a global sensation. People are lining up for hours to buy these things. It shows this underlying desire for connection, for something simple and joyful in a world that feels increasingly complex and overwhelming. The system is pushing, and the people are pushing back.
Okay, I see your point. People are looking for an escape, but I don't think that's necessarily a bad thing either. Consumerism can drive the economy, create jobs. It's all part of the cycle,
But what kind of economy are we building? One that preys on our vulnerabilities, that manipulates us into buying things we don't need while our healthcare system crumbles around us. We can take a lesson out of the Labubu craze. tap into that same human need, but instead of selling toys, address fundamental human needs like access to affordable healthcare or high-quality wellness programs.
It's a false economy. The Labubu frenzy is a symptom of the same underlying problems. People are desperately searching for something real, something meaningful, in a world that feels increasingly manufactured and superficial. And the healthcare system, with its mountains of paperwork, endless bureaucracy, and astronomical costs, feels like the epitome of that artificiality.
Okay, I get that. But how do you propose we fix it? I mean, a complete overhaul. Where do we even begin? The system is so complex, so entrenched.
We start by shifting our mindset. Healthcare is a human right, not a commodity. We need to decommodify it, take the profit motive out of the equation. Look at universal healthcare systems in other countries. They're not perfect, but they generally achieve better health outcomes at a lower cost.
Absolutely. And it's not just about economics. It's about morality. It's about saying, we value human life. We believe that everyone deserves access to quality healthcare, regardless of their income or social status. And then we build a system that reflects those values.
But those systems often have long wait times, limited choices. I mean, there are downsides to every approach. And how do you fund it? Taxes. People already feel overtaxed.
Yes, taxes, but we're already paying for healthcare, just in a far more inefficient and inequitable way. We're paying through premiums, deductibles, copays, and, for many, through crippling medical debt. A universal system might mean higher taxes for some, but it would eliminate those other costs and ensure that everyone has access to care when they need it.
And think about the economic benefits. People who are healthy and have their basic needs met are more productive, more creative, more engaged citizens. Investing in healthcare is investing in our future.
Okay, I see that. But what about innovation? What about the pharmaceutical companies? They need to make a profit to fund research and development of new drugs and treatments.
There are other ways to fund research and development, public funding, grants, nonprofit organizations. We don't need to rely on a system where companies are incentivized to prioritize profit over finding cures or to price gouge patients who are desperate for life-saving medication. How can that be legal? How can something so essential to life be a profit-driven game? I feel like that is the root of the problem.
And that's where the generational trauma comes in, right? Decades of being told that healthcare is a privilege, not a right, that you're on your own, that if you can't afford it, that's your problem. That kind of messaging creates deep-seated anxiety and distrust, especially in communities that have been historically marginalized and denied access to basic necessities.
Okay, I'm starting to see the connections more clearly. The economic anxieties, the lack of trust in institutions, the pressure on healthcare workers, it's all feeding into this cycle of burnout and frustration.
Exactly. And it's not just about individual feelings. It's about the real-world consequences. Staff shortages, poor patient care, rising violence. It's a vicious cycle, and we need to break it.
So, what are some concrete steps we can take besides advocating for a complete system overhaul? What can we do to support healthcare workers right now?
We need to address the root causes of their stress and burnout. That means reducing paperwork, streamlining administrative processes, and empowering them to make decisions in the best interests of their patients, not the bottom line. The incentive is to keep the patient healthy, to add extra years to their lives.
And providing them with more mental health support. Access to therapy, mindfulness training, peer support groups. They're dealing with incredibly difficult situations every day, and they need resources to cope.
And we need to create a culture of appreciation and respect. Healthcare workers are often undervalued and overlooked. We need to recognize their contributions, celebrate their successes, and let them know that we see them and we appreciate their dedication.
We could encourage students who want to get into healthcare, provide better schooling programs, financial assistance, and incentivize those entering a very important, stressful career. Think about it. What if the military parade was a group of healthcare workers marching down the street? How would that incentivize our children? It would tell them that caring is cool.
Maybe we can implement changes like requiring longer breaks, more vacation time, and more flexible schedules. Many feel overworked, and that will lead to burnout.
Exactly. But how do you pay for all of this? That's always the question, right? And I think the answer is that you reprioritize. You take money from the things that aren't working, like bloated administrative budgets and unnecessary military spending, and you invest it in the things that will actually improve people's lives, like healthcare and education.
And you hold the system accountable. You demand transparency from insurance companies, pharmaceutical companies, and hospitals. You shine a light on the practices that are harming patients and workers, and you demand change. You punish those who are not prioritizing patients over profit. The system starts to change when they know the people are watching.
And you get involved in the political process. You support candidates who are committed to healthcare reform, who are willing to stand up to the powerful special interests that are blocking progress.
Exactly. It's a multi-pronged approach. It's about changing hearts and minds. It's about changing policies, and it's about changing the system itself. It's a long and difficult road, but it's a road we have to travel if we want to build a healthier and more just society.
I think the recent poor CEO and the praise he received is an encouraging example to show that even in the face of tensions between countries, prioritizing business and trade can be beneficial. If we can apply this principle to healthcare, we could have better international cooperation on improving public health in different countries.
It's a balancing act for sure. We need that combination of governmental involvement and privatization to have a healthy economy.
Well, I'm hopeful. I truly believe that the events unfolding right now, the Manjiane case, the growing frustration with the system, the increasing awareness of generational trauma, it's all creating a perfect storm for change. We have the opportunity to build a healthcare system that is truly worthy of the name, a system that prioritizes human life and well-being above all else.
Well, let's fight for it together. Let's deny the status quo, defend those who are fighting for change, and depose the forces that are holding us back. Health over wealth, always.
Thanks for having me and for the conversation. Always great to hash these issues out. I will continue to be an advocate for those on the front lines.
Thank you all for listening, and I look forward to a better healthcare future.